that Rogan's volunteered to do, just to sort of highlight some of the processes he went through. Is it okay to say unsuccessfully?
Oh yeah, definitely.
Okay, stuff that just didn't work, and to highlight the things that did work, the things that actually got you to get yourself more emotionally stable together. After Rogan had a quite serious brain injury, quite big attack, wasn't it?
Yeah.
And had set him back some, and now he's getting back together in a big way. I'm pleased for that.
Yeah, so nice.
I bet you are, mate. I bet your whole family is. Nice to see you getting
That's
back
good
on form.
Yeah.
So tell us a little bit about what you told me yesterday, because that's why I was so interested.
Well, I mean, initially, the injury was 7 years ago, and it's been quite a struggle actually trying to get on top of anything.
Yeah, sure.
And specifically, being able to control emotions and stuff like that.
Mm-hmm.
Everything was maxed out. You know, it wasn't just I feel a little bit happy, I feel a little bit peed off.
Yeah.
Or anything. It was a case of like, oh, I'm manic or I'm punching walls.
Yeah, sort of like almost being described as bipolar. Did anybody call it that?
It was bounded around a few times.
Yeah, easily bounded around. Probably just emotional instability, really, rather than a proper bipolar kind of thing. But there you go. There's an indication of how easy it is to misdiagnose something, which is, in a sense, I would say, kind of natural emotional responses as your brain is rebuilding and your emotions get. That's what I think.
Well, yeah.
Anyway, because you weren't bipolar before, were you?
No.
Well, there we are.
I was a kid, so I was have to be pretty average.
Fair enough. Go ahead.
Well, it was. I mean, to be honest, the best thing that I can say is if I start with the result and then I guess go back to what we
however you want to tell it.
I moved up to Edinburgh last year and I'd been seeing another GP and stuff like that, and eventually at the beginning of the year I was passed on a link to a hypnotherapy self-hypnosis disc to download.
Yeah.
In all honesty, I turned around and was like, oh god, stuff.
Yeah, exactly. Sure.
And then I downloaded it anyway and I played it and I thought, oh good god, I'm not doing this.
This is just silly nonsense.
But I mean, I was in a pretty bad state. I mean, it was to the point I was agoraphobic. I couldn't even go out the flat to go down the shop at the end of the street.
Right.
I was seriously messed up.
I
mean, everything was making us angry. Everything was stressing us out. Everything was scaring the crap out of us. And I was like, you know what, I've got to do something. So I'll give it a go.
Right.
You know, and the instructions came where it says basically listen to it for as many times as you can the first week, and then you go on to the next track the second week and stuff. And so it's exactly what I did. And after about 3 or 4 days, I kind of realised that I was feeling a bit calmer and a bit more relaxed, and actually knew what relaxed was.
Meant.
And so I kept on going, and to be honest, I started noticing a major change, and so did everybody else. And I kept on going, and that's when I started thinking, there must be something in this.
Yeah, something's going on here that's different. Yeah.
I started looking around. I thought, what I'll do is I'll go to a hypnotherapist.
Right.
And that's when I thought, well, what I should do is I should talk to somebody who's not in the local area, because obviously whoever's local is going to say, oh, I'm best. So if I go to somebody else where it's not, they know they're not going to get the benefit of it, they'll be honest and say, look, you want to look for this, you want to look for that.
Right, okay.
Which is actually how I got in touch with yourself.
Oh, okay, was it? Okay, I never knew that, but anyway, now I do.
Well, now you do, exactly. And I mean, what I did, if I remember right, I think I sent actually a generic email to about 3 people.
Right.
And you responded.
Yes.
And turned around and said, well, basically, and you give a structure of terms and look, you want to look for this, you want to look for that.
Yeah.
You know, make sure that you look for the right things and you explain yourself fully and stuff like that, and then you offered to call us. At the bottom of the email, you offered to call us.
Did I? Okay, yeah, fair enough. I remember that now. Yeah. I said, make sure they can do this and that. I'm with you now. Yeah.
So I replied, turned around and said, it would be good to talk if I could give you a call.
Yeah.
And I called up and I briefly spoke to Jan, who.
That's right. I remember that well. Yeah.
That's when you were. I mean, you didn't do any hard sell or anything like this about this. You just had to turn around and explain that you knew about it because you've been doing it for so long and stuff like that, and do this and stuff. So because I think I was picking your brains out. How do you know all this stuff?
Yeah, I think so. Well, I remember a lot. What I remember of it was you saying, "Well, could I learn to do this?" I remember because I've had this, and you explained that you had the brain injury.
Yeah.
And I explained to you that I think since you're even asking the question sensibly or something like that,
Well,
I
yeah,
think you
yeah,
can.
I remember. Yeah, that's right.
Something like
Yeah,
that.
you turned around and said, you know, even you could do it. You know,
Well,
it wasn't quite like that. No,
I know.
it wasn't like even you could. No, it was a case of, you know, okay, anybody. You know, and, well, I guess the submodality.
Yeah.
If one person can learn it, another person
exactly.
can. So you know, you were explaining that, and I was like, well, even with because I explained how I had like memory problems and all that sort of stuff.
Yeah,
and you turned around and you were. Yeah, well, you were honest. You turned around and said, if that's what you wanted to do, then yes, you could certainly do it. And after a while, I started looking around the web as you do. You know, Google, best thing in the world.
Google, you find out everything.
Yeah, and well, obviously, you know, here I am.
Here you are.
So and I've got I mean, the difference between coming here the first day, which I guess everybody else that was here the first day would say, I was bricking it. You know?
Yeah, you look tense.
I was very nervous.
Yeah, you looked a bit nervous, but
you
looked tense. I didn't know you were that nervous.
Yeah, no, I was that nervous.
Right. So, well, I'm glad you're not now because we have a good laugh. Oh yeah, we share a good sense of humour and we have a good fun together, you know, and with the whole group actually.
Yeah.
And this is actually not a sales pitch. I know it sounds like it. This was not the intention.
No, buy this DVD.
Exactly. Well, what I was kind of going for was that the stuff you did with listening to the CD and the stuff we did on the first or second day or third day, whenever we did, I'm suggesting to you, you found very valuable and it's worked really well for you. But prior to that, you've done like what you just briefly, how many different stuff that hadn't worked?
Well, from initially where I lived down in Loon at the time, I saw 3 different trauma doctors.
3 different trauma doctors. This isn't about, and before I imply anything else, this isn't about, was this about the physical nature of the brain damage, or was it about the psychological consequences?
No, it was about the results of it.
So it was about the psychological consequences.
Yeah, no, the medical side was the medical side and so forth. So I'll just concentrate on
the after effects.
Okay.
So you got 3.
How are you feeling? Sort
3
of stuff,
brain specialists.
Yeah. First of all, I went to that who I kind of got passed around. I saw one, explained it. I said, you know, something's not right. I don't know what's going on, and I was really confused about everything. And they passed us on to somebody else. Who passed us on to somebody else. So that was the 3 down there.
3 down there.
Yeah. So that was in the first 4 months. So I came up to the northeast to be near my family.
Yeah.
Where I saw a neurologist.
Right.
Who sent me to a neuropsychiatrist.
5.
Who subsequently left but passed us on to another neuropsychologist.
6.
I also neuropsychiatrist.
Okay.
And then while I was at the specialist head injury department,
7.
I had a care manager
8.
who passed me on to the psychologist.
9.
Who was also passed me on to the occupational therapist.
10.
The CBT, so
11.
behavioural therapist. I had 3 different GPs that I've been to see because
basically 14 or 15 now.
Yeah, a counsellor.
I've run out of fingers, so I can't do it anymore.
Must forget a counsellor and stuff. I had a psychiatric nurse that was coming out.
Yeah.
I know I've missed somebody out. But a few.
Yeah.
So 1 or 2, and this was all in the space of probably about 5 or 6 years. And like I say, it was a case of take this drug.
Take this drug.
Go away. Take this drug. Go away.
Did none of them actually tell you that it might take a little bit of time for your brain injury to heal?
Well, that depends on who you spoke to.
So you're getting different messages for everybody.
Some people turn around and say that you'll whatever you're at after 6 months, that's the level you'll be at.
Oh, that's really not a good thing to say to people.
No, especially because at 6 months I couldn't remember anything. I was setting everything on fire when I was cooking and stuff like that.
Oh God, really like that? It was that serious?
Yeah, no, I destroyed complete sets of pans all the time. I would just put something on and walk out flat. I would just totally forget.
Oh my God, so it was actually dangerous.
Oh yeah.
It wasn't just inconvenient.
No, it was very dangerous.
Right, okay, mate.
I would leave.
You don't have that
leave the
anymore.
gas on. No, I don't. No.
Cool. No, you seem really together to be. now. I mean it, no, because you can fun.
Well, the memory stuff I gained control of, and I learned how to set little things
Well,
up, timers and stuff.
Well, you know, even here, I mean, when I'm teaching you, yeah, you ask the question, but they're always sensible questions, and I don't think you particularly forgot anything that was really essential. I mean, you might mix a word up from presupposition to submodality or something like that, but you know what it is, which you just said. But it doesn't. But I knew what you meant.
Yeah.
And it's not a big deal. So there was no sort of like you forgetting something essential.
Yeah.
You know, it's all just the normal. I would consider it normal because NLP is so full of jargon as well that it's easy to mix up.
Yeah.
Do you know what I mean?
Yeah,
That kind of.
that was
Everybody finds that. Yeah.
Really
exactly.
panicked the first weekend.
Yeah.
I mean, we're only. You know, I mean, what I did was actually made myself an MP3.
Yeah.
Which I play to myself.
Yeah.
Which basically turns around and says, you know, not to worry, you know, relax. I can recall the information that I need to.
That's good.
And yeah, no,
sure, it works.
But the whole thing's been a massive difference.
Good. Well, I'm really pleased for it.
All the family now. I mean, my mother, who to be honest, I didn't speak to her for a year and a half.
Yeah.
And in the last 3 months, you know, I mean, I'm now going down there, staying there. We're having a laugh, a carry on, and stuff.
You can have a good time and get back to normal.
Her words, literally her words. After the last time I was here, when she was like, I can't believe the difference. It's so nice to see the old sun back.
Yeah.
You know, tears in her eyes. And
really, she meant it.
Oh, big time. Yeah.
Oh well, I'm pleased for you, man.
Yeah, so much.
But I know I'm just pleased for it. You know, it's just great to see that you're recovering so well that you don't even look like this. You know, what's going to be wrong with you? You know, I don't see it because we have a joke, we tease each other, we have a bit of a laugh.
Yeah, but that's the thing. You see, last year I would have gone off on one. I would have stormed out.
So you would have had a
dragging this blind with us.
Exactly. But now you don't.
No,
you don't need to, and you've done it through your own good work, hard work, and utilising modern hypnotherapy and NLP skills. Really.
Definitely, I'll push this as much as I can, which is why I want to try and help other people.
Well, I think that would be great for you to do that. That would be inspiring. Because just when you said that, you know, some people have told people like it's going to be 6 months and that's where you'll be forever.
Yeah.
Well, you know, that's really backward because actually they know the brain has brain plasticity. Yeah, well, now there'll be some injuries that people will have. You know, I told you about Neil who had been here. I don't know if I did it. Remember on the phone? Yeah. I said I had a guy here and he came up to me and he hadn't told me this before and he said, can somebody with a third of their brain missing learn these things? And I was kind of taken aback. I was kind of like stunned, you know what I mean? I was like, and I said to him, well, the very fact that you got here, the very fact that you can ask the question, I can assure you, you can learn to do this. And sure enough, he has. He's a sports coach because he was a great cyclist. That's how he got his brain injury. So I don't subscribe to limiting beliefs about things. I mean, if you lose a leg, you are going to be a leg down until they get the cellular thing right to grow legs. You know, and I'm sure that if there are some brain injuries that occur, you know, say in the optic nerve or something like that, then there'll be adjustments that are necessary to make. So I'm not saying that everything is, you know, going to be, but the idea that some kind of brain injury, particularly if it's associated with emotionality, is like a fixed thing. I completely have my experience says no, that's not true. People can recover. People can expand. You're living evidence of it. So is Neil. So. That's really what I wanted to get across. Not so much a sales pitch, but just a message that people don't have to be held back by limiting belief things, not only self-limiting beliefs, but sometimes beliefs that we take from authority. Now, I have nothing to say, good or bad, about all the authorities that you saw, and I'm sure they had your best intent in heart, and probably the surgeons and all that. I most highly respect all these people. Maybe not. Well, using those experiences. Well, I like to be generous to it rather than. But the main thing is, there was over like 15 different things you said there, I think, of people you saw, and you really got nothing until you started doing hypnotherapy from that good doctor.
Well, that's the thing. If anything, I started going downhill because I was so messed up, basically.
Yeah, it made you worse because they keep telling you you're not getting any better.
Yeah, I wasn't depressed. They kept telling us I was depressed.
Yeah, exactly.
But all I was confused, saying, there's got to be something where I can do it. There's got to be something.
Yeah.
Well, no, there definitely is.
Yeah, cool. Great. Good. I'm trying to thank you. Yeah, brilliant. Thank you very much.